There's something different going on today at UC San Diego Medical School. First and second year students are invited to hear from some of their soon to be graduating colleagues. These select few on the panel have been nominated by their peers to be in the Gold Humanism Honor Society. The organization honors medical students who have the talent to be a truly caring and empathetic doctor. Each panelist describes a moment when the light came on about what it means to be a compassionate physician. Perhaps the most interesting story comes from the final student to speak, 32-year-old Preetha Workman. Workman has a unique background. She did her undergraduate work at the U.S. Naval Academy. She then spent 6 years in the Marine Corps, rising to the rank of captain. In the midst of medical school, she's been raising a young child. Workman says she's realized being a good doctor requires a lot more than just book knowledge.
Ask any patient, ask any individual in our society, how do they feel the medical system treats them? Sometimes the care may not be technically enough, and they'll tell you, but I think a lot of times people feel ignored, abandoned, not listened to. And I think it's just having that awareness that I think our patients are going to start demanding more. Well, they want more. I would. I want that as a patient.
Workman tries to keep that in mind when she interacts with patients in the emergency room.
Hi, because all I get to see really is the triage note, and I understand you were recently diagnosed with pancreatic cancer?
Yes.
How did that come about?
Well,
Workman takes the time to listen to patients and their family members.
I was always shopping with my grandson.
After she visits with a patient, Workman discusses each case with an ER doctor.
It sounds like he went to go see his oncologist over at the Morris Cancer Center today for a scheduled visit. He had chemotherapy his first round last Saturday. And he comes in, he's referred in. They said they were concerned there might be something going on with his heart.
Dr. Jim Dunford says physicians have to have good technical and clinical skills, but he says they also need to be able to relate to anyone who walks in the door.
We have drug addicts, we have alcoholics, we have people with terrible metastatic cancer problems, heart failure, we have dementia patients, we have children where the parent is as much a patient. You got to read that setting, and within 2-3 seconds people are going to understand whether or not you really are into the problem and they're there to help them, or if you're just kind of trying to just be a technician, and that's not what medicine is.
Dr. Dunford says physicians are involved in the real-life drama of people's lives, and they must play their part well.
If you're going in the room to tell a family that grandma's just died, you've got to be good at that. Because those people will remember that experience for the rest of their life. It's very key that you know how to be able to communicate good and bad news and be able to share with people and still represent yourself as a professional.
When it's her turn to speak at UC San Diego Medical School, Workman describes an incident that really hit home. She was on her surgical rotation. Her medical team flew up to the Central Valley to collect a liver. The donor was a teenager who had been shot in the head. His mother made the decision to donate his organs to save someone else's life.
When I finally saw the results and how we saved someone, I was happy, but that day, as someone's mother, I had to mourn. So I'm not sure if being a doctor is making me a better mom, but I think being a mother is making me a much better doctor. That's my story.